Hello my dear pharmacist friends, welcome to this new pharmacy MCQs video. In this video again we are going to discuss a new set of 10 MCQs. Our first MCQ, the icosa part of eicosanoids refers to 6 carbon atoms, 10 carbon atoms. Third option is 20 carbon atoms, 30 and 46. Actually, icosa in eicosanoid, it is an ancient Greek word and it refers to 20. So it is actually 20 carbon atoms. Now the next MCQ, which statement of the following is incorrect regarding paracetamol? So we have to identify in the following options one statement about paracetamol that is not correct. So options are: has no anti-inflammatory effects. Actually this statement is true because paracetamol have analgesic effect and antipyretic effect. They have no anti-inflammatory effect. So A statement is correct regarding paracetamol. B option is they have no gastrointestinal side effects as NSAIDs have. This is also correct statement about paracetamol because they don't have that much gastrointestinal side effects as NSAIDs have. C option is not safe in cardiovascular patients. Actually this statement is incorrect about paracetamol because paracetamol is the safest analgesic and antipyretic in majority of the patients in most of the conditions, even in such serious conditions as cardiovascular diseases. Also in pregnancy paracetamol can be given. It is actually the safest analgesic which can be prescribed. So C is the right answer for this MCQ. Also D option also correct about paracetamol since the mechanism of action of paracetamol is prostaglandin synthesis inhibition. And the last option, its maximum daily dose is 4 grams in adults. So this is also correct statement about paracetamol. So the only statement among these is C, that is incorrect about paracetamol. So C is the right choice for this MCQ. Identify the NSAID among the following that has no antipyretic activity. Actually NSAIDs are the non-steroidal anti-inflammatory drugs and they have generally anti-inflammatory activity, analgesic and antipyretic activity. But there is one agent among the following options that has no antipyretic activity. So options are flurbiprofen, naproxen, mefenamic acid, diflunisal and aspirin. Actually among these it is diflunisal that has no antipyretic activity. Phototherapy that is indicated for the treatment of neonatal jaundice uses the wavelength of UV light, red light, yellow light, blue light and violet light. Actually in some cases the neonates, that is the newborns, they develop jaundice. This condition is called neonatal jaundice and it can be treated with phototherapy. And in this phototherapy the wavelength used is actually that of blue light. Actually the blue light wavelength is used in the phototherapy that is indicated for the treatment of neonatal jaundice. The only irreversible inhibitor of cyclooxygenase enzyme among the following is: options are aspirin, paracetamol, ibuprofen, indomethacin and diflunisal. Actually among these the only irreversible inhibitor of cyclooxygenase enzyme is aspirin, while the rest will inhibit this enzyme cyclooxygenase reversibly. Now the next MCQ, identify the antihistamine among the following that is also an appetite stimulant. So options are fexofenadine, ebastin, diphenhydramine, hydroxyzine and cyproheptadine. Actually among these the antihistamine that is also an appetite stimulant is cyproheptadine. It is actually used in syrups that are intended for appetite stimulation purposes. Like in our Pakistani market, the brand Trimetabol is there. It actually contains cyproheptadine that functions as appetite stimulant. Antihistamine that can easily cross the blood-brain barrier and thus produce sedation is options are fexofenadine, cetirizine, levocetirizine, loratadine, and diphenhydramine. Actually, the antihistamines that can easily cross the blood-brain barrier and thus can cause sedation are the first generation antihistamines, while the second generation antihistamines are not so much sedative in their pharmacological activity. So among these options, the first generation antihistamine is diphenhydramine. Diphenhydramine will cross the blood-brain barrier easily and can cause this sedation effect, in which the patient will feel drowsy and sleepy. So they are not advised in conditions in which the patient have a job in which alertness is critical. So machine operators, pilots and other heavy machinery operation is not recommended during its use. The next MCQ, the gastrointestinal adverse effects of orlistat can be minimized through a plan of low-fat diet and concomitant administration of. So options are omeprazole, vitamin D, cholestyramine, dimenhydrinate and loperamide. Actually, the gastrointestinal adverse effects of orlistat can be minimized through a plan of low-fat diet and concomitant administration of cholestyramine. Among the below, identify the prophylactic anti-migraine medication. So options are given: a-dihydroergotamine, naproxen sodium, amitriptyline, zolmitriptan and diclofenac potassium. Actually, all these agents are used in the treatment of migraine headaches except amitriptyline, which is a tricyclic antidepressant, and it is also used in the prophylaxis of migraine. The only anti-obesity preparation among the following that has no adverse effect of suicide ideation is bupropion, naltrexone, liraglutide. C option is lorcaserin. D option orlistat. E option is no anti-obesity prep have such adverse effect. Actually, the question asks us about the only anti-obesity preparation among the following that has no adverse effect of suicide ideation. Actually, most of the anti-obesity preps or preparations have the side effect of suicide ideation. So this E option is at least not the right option, as it says that no anti-obesity preparation have such adverse effect, because most preparations do have this adverse effect of suicide ideation except orlistat. Orlistat is the only anti-obesity preparation among these that has no adverse effect of suicide ideation. Friends, this was enough for this video. Thanks for watching. I hope you have learnt something or other from this video. For more such pharmacy MCQs videos, subscribe to our YouTube channel.